Well, good morning, everyone. Welcome to the Boca Chambers, a special virtual program today with the CEO of Boca Raton Regional Hospital, Lincoln Mendez. My name is Troy McClellan. I am your president and CEO, and we are thrilled to be able to have Lincoln come on today and talk about the upcoming campus expansion plan that they have. And this program is being recorded. If you are not a subscriber to the Chamber's YouTube channel, please do that. And then you can go back and watch this again, or you can suggest that someone else watch this, in addition to a lot of our other content that we've had in this virtual environment that we live in. As many of you know who have been around this community for a long time, then Boca Raton Community Hospital and its rich history and how it was founded has been a part of Boca Raton for, well, 50 plus years. And now that journey continues. And this is an extremely exciting expansion plan that the hospital has in store for us. And you're going to learn about it today, hear about some of the details, see some beautiful renderings, and how the campus is going to continue to transform and improve and continue to have the world-class healthcare that we enjoy now, but with even newer facilities and newer amenities as we move forward. So before I turn it over to Lincoln, he is a very distinguished professional in the healthcare and medical industries, and he's got a very long bio, but we've got it down to something I think that is manageable this morning. And so I want to read some of it to you, so please bear with me on that. So Lincoln Mendez took over as CEO of the Boca Raton Regional Hospital a little over a year ago in July of 2019. Prior to this role, he served as the CEO of South Miami Hospital for almost a decade. And before that, he held the position of CEO at Doctors Hospital for a total of 14 years. During this period, he was CEO of Health South Doctors Hospital, Inc. For the 8 years prior to Baptist Health South Florida's acquisition of Doctors Hospital in October of 2003. Prior to his employment with Health South Doctors Hospital, Lincoln was the Chief Operating Officer at Kendall Regional Medical Center in Miami from 1993 to 1995. He holds a master's degree in health administration from Florida International University and both a Bachelor of Arts in Biology and a Bachelor of Science in Medical Technology from Southern Advent University in Collegedale, Tennessee. Lincoln is a member of the American College of Healthcare Executives and is licensed as a laboratory supervisor and medical technologist from the Florida Department of Professional Regulations. He currently serves as past chairman of the board of the South Florida Hospital and Healthcare Association. He's currently serving as an alternate for the American Hospital Association Regional Policy Board. And Mr. Mendez is currently a member of the Orange Bowl Committee, the South Miami Chamber of Commerce, the Greater Miami Chamber of Commerce, and the Florida International University Council of 100. He also served as adjunct faculty for the Florida International University Graduate Program in Health Administration. And of course, Mr. Mendez is a member of the Boca Chambers, the Board of Directors. So Lincoln, I'm going to turn it over to you. Thank you so much for being here. We are more than excited to hear from you, learn about this amazing expansion plan, and then give our audience an opportunity to interact with you and ask some questions. So thanks for being here this morning. Welcome, and I'm going to turn it over to you.
Okay, well, thank you, Troy, and good morning, everyone. Thanks, Troy, for the bio, the very nice comments, and the fact that you only gave me about 2 minutes to speak now after all that introduction. But anyway, I'm just very grateful to be here this morning and very, very excited to talk about the plans for Boca Regional, and Troy mentioned some of the history here, the community involvement with the hospital. So again, very, very excited to be able to share these presentations, and we're at the stage where these are final renderings, and looking forward to the day when we can get these projects started. With that, obviously in today's environment, I get a lot of questions about the COVID situation. So I thought I'd just spend a few minutes just looking at the COVID cases, getting everybody up to date, and something that we as management here at the hospital, we're always looking at these stats. We want to see if there's any trends, and I'm going to share some of these with you. So we get this information provided by the state, and we get it from the county as well. But here's just a quick overview of where we're at with the COVID situation here in Florida. And this is, again, it gets refreshed quite a bit. This is from October 25th as of that date. So if you look at the number of cases in Florida, and just interesting, you can see how it's broken down with male, females, who is testing positive. And keep in mind, these are just cases that have tested positive. And don't get that confused with hospitalizations. Very, very different there. So when you look at the median age, the ones that are testing positive, it's around 40 years old. And in the state of Florida, 6% of the positive cases end up getting hospitalized. And then unfortunately, there have been mortalities associated with the COVID virus. So you can see that in the state, that's running about 2% of the positive cases ends up in a mortality. Now, if you drill down a little bit further into Palm Beach County, you can see just over 50,000 cases. Our median age here of those that are testing positive, it's just a little bit older at 41. But again, I think Palm Beach County, everyone realizes it's a little bit more of an aging population here. So that's really reflective in these stats. And hospitalizations, as you can imagine, 8% of the cases, just a little bit more. And also with the number of mortalities, it's ends up being around 3% of the cases that have tested positive in Palm Beach County end up in a mortality. So this is a great slide. I'd like to present this at several different meetings that I amassed to present some information. But again, this is from the county. You can see that these are as of the October 25th. So the number of total cases is broken down. I love the fact that it's broken down by the different age categories. And keep in mind, we're reporting this data. Every hospital in the state is reporting data to the state on a daily basis. It goes into an ESS system, but we're reporting the data as far as hospitalizations, how many tests we did here through the emergency room that were negative, how many were positive, any reference lab, all those tests that are being reported, they report up to the state as well. And that's how they get all this information. So a few years from now, there'll be some public health research programs that'll come into play because of this. Right now, there's not a lot of time. We're just kind of getting this data dumped on a almost daily basis. So when you look at this, you can see where the positive cases are. So I've kind of blocked off those areas. If you look at the age categories where all cases are coming from, the majority are starting from the 15 to 24-year-old bracket all the way to the 55 to 64-year-old bracket. When you look at the new cases, so again, these are going to be that on that particular day, you can see there was a total of 280 of those cases right there. You can see where it's a younger population that's getting it. So the 15 to 24-year-olds, the 25 to 35, that's kind of where the bulk of the cases are, but still within that box, which is reflective of the overall number of cases. And then when you start getting to the hospitalization, look at how this graph changes drastically. So when you look at who's getting hospitalized, when you look at the 15 to 24-year-old bracket, which is the higher number of cases, the newer cases, that only represents 3% of the cases that are getting hospitalized. And when you look down at the box, who's getting hospitalized, the sweet spot there is between the ages of 45 and 85 plus. That's where the hospitalizations are coming from. That's the age brackets. Those are the ones that are most vulnerable. And that's what we're seeing it. And we're seeing this, again, state information, but this is what we're seeing in the hospitals as well. And unfortunately, if you look at the last column, look at the difference in there. So when you have the 85 year and above, that represents 41% of the deaths in a hospital. So our average age here of mortalities in Boca Regional has been about 83 years old. So it's right along lines with what's happening. But again, this is why there was a lot of emphasis on protecting the nursing homes, not allowing visitors, et cetera. Definitely the elderly population is the one that's most vulnerable. So this is an interesting graph, is that we get this every day from Baptist Health. So Baptist Health is comprised of 11 acute care hospitals. So when you look at the top graph, and just focus on the top graph of this report, but this is the actual report we get, and you can tell this is of yesterday at 8:09 a.m. So if you look at this graph, the top one tells you all the hospitalizations, all the new admissions that happen within Baptist Health since this started. So if you look, you probably, I don't know if you can read that far left-hand part of the graph, but it looks like our first admission was probably on March 9th. So every time you see where the columns are turning different color, that represents new months. So if you look at the primary wave, that's where you see the first gray column coming up. So on April Fool's Day, ironically, there was 54 admissions in Baptist Health throughout the whole system. Again, this is not Boca Regional, just throughout the whole system. And that was when the peak of the first wave. So that primary wave, that's when you were hearing everyone was in short supply of PPEs and short supply of potentially ventilators and things like that. There was really not a lot of treatment protocols yet. It was just to get them on a ventilator and just try to help them out as much as possible and see if you could possibly wean them off the ventilator as they try to recover from this. Again, it was a tough road for the elderly population during this time. Then you look at what's happened after that primary wave. We had about a 2-month period where there was not a lot of activity, some activity, but not a lot. But then you can obviously see from this graph that there was a second wave, and that second wave hit us hard and throughout the whole healthcare industry. And in Florida, this is where, in South Florida in particular, in Miami-Dade County, this is where a lot of that activity was going on. But you can see the secondary wave hit approximately July 14th. That's when it peaked out. And then that curve just took a long time to flatten out. And if you look at what's happening now, you can see that the curve flattened out, but there's this little activity that goes on that kind of you're just paying attention to it. So when you have events like we had Labor Day holiday, we look at that and we kind of look 14 days past that and just to see if there's any increased activity. So I believe, my personal opinion is, between the first wave and the second wave, obviously we were in a better shape with PPEs in the second wave because we were able to replenish stocks and more manufacturers doing that. Some of the industries, auto industry, were changing some of their manufacturing to provide additional ventilators, et cetera. So we really learned a lot between that primary wave and the secondary wave. And also the treatment started coming out, some treatment protocols, which I'll discuss in a minute. But just to let everyone know, we're just monitoring this on a daily basis. And this is how we try to figure out things like visiting hours, staffing levels, and we're just a lot better prepared right now in the event of another wave. I believe between the first and second wave, when things opened up before the second wave, I think folks just kind of realized we just went through a bad situation with the primary wave, and we as a society probably let our guard down. Even though we said we're going to open things up, you have to wear a mask, etc. I'm not sure if a lot of people were following that. But as it became more prominent, you see more folks wearing the mask, washing their hands, and social distancing. So we're hoping that will just keep that curve very, very flat. So more specific to Boca Regional. So I get asked, how many people have COVID? How many have been discharged and things like that? So right now we have over 700 of our community members that have come in through the hospital with the COVID symptoms and COVID tested positive for COVID. And they ended up getting discharged. So the treatment's getting a lot better. We have had over 700. I put the Rocky theme music in there, so all of us know what the theme to the Rocky movie is. And that's one of the things that we pipe through the whole hospital. Whenever there's someone that's getting discharged, it's kind of a rallying cry. We put that music out there, and it's good for the staff. It's good for the patients as they're getting wheeled out. They feel like Rocky, that they've survived something, which they have. And for the staff, I think it's good too. It's good medicine for them to know that they're making a difference, and the things that they're doing is impacting our community. So for the hospital staff, the medical staff, it's been great to have that music playing over the system, and it plays regularly. So again, I think that's been a great program. As far as the COVID patients, I just put in here over Baptist Health. Remember, over 11 hospitals right now. If you look at the number of patients in ICU and the number of med surg patients, there's a total of 154. This is as of 2 days ago. This morning it was 142, so that number's gone down a little bit as well, but it'll fluctuate around that time. When we were at our peak in July, that number was, I believe we peaked out at 856 patients just within the Baptist Health System during that time. So that tells you where we've been, and it tells you where we're at now. We've actually gotten as low as 108 about 2 weeks ago. But again, it's just it just seems to be a little bit of a slight increase, but then we get admissions, but then we have more discharges, which is a positive thing. During this whole process, there's been a lot of communications going on within the county, with the state, a lot of calls, and sometimes we're at the peak, we were meeting having calls on a daily basis. So I give a shout out to the county and really the local officials too. They were reaching out to me at all hours of the evening, just asking, how are things going? What do you all need? And very, very grateful and appreciative for our county leaders, or city leadership for reaching out to me, and again, on a continual basis. So we continue to monitor all admissions, the ventilators. Again, you can imagine that was a crisis at one point. So we always keep track of what our needs are. And right now we're in good shape as far as supplies, PPE supplies and vents, we're in good shape. We have limited visiting hours as we speak. We still do not allow any visitors into any portion of the floors that are taking care of COVID patients. And again, just an overabundance of caution for not only our staff and the medical staff, for really the patient and their family members. So we do everything possible to accommodate the visitation with the family, but we're doing it through Zoom. So we'll give the patient an iPad, we'll make that connection and just make sure that the patient can see their loved ones during this time. Any end of life situations, we take an extra step just to make sure that if it looks like it is going to be an end of life situation, we try to get the family in here and just have that quiet time together. As far as treatment protocols, there's been a lot going on, and I mentioned convalescent plasma here just because that was one of the early methods, and it seems to have some positive impact. So just to put that in perspective, if you have the measles, you develop antibodies and you don't get it again. So the same thing was the concept with convalescent plasma, that once you're positive, you wait about 14 days or so, and right between 14 and 28 days, you're peaking with antibodies. So the concept is have that patient go donate plasma, and then that plasma can be given to a patient that is currently in the hospitals, and those antibodies will give them an extra little booster shot to try to get over the COVID-19 virus. So that's been very, very favorable. Remdesivir is another antiviral medication that was developed years ago, I believe for Ebola and some other viruses, that it didn't really work for that, but somebody decided to dust it off the shelf and try it for the COVID-19, and it actually has had some really, really good results. And this one, if you've been keeping up with what's going on in the papers and with the COVID virus, this one just received the FDA approval for that. It had an emergency use authorization, but now it was given full approval for that. So that is one good thing. The other one is Regeneron, that you recently with President Trump being hospitalized I believe at Bethesda Memorial up there. He ended up getting several things. He got remdesivir, he got Regeneron, which is an antibody, but this is a man-made antibody cocktail that it's under trial studies. But again, it's shown some positive results, and it's not letting the virus replicate, which is very good. So now let's talk about the hospital. So this one, I love this picture. This picture is from around 1967. I'm not sure if somebody knows what kind of car that is, but it looks like an old car. But it started out at the hospital in '67 as a Boca Raton Community Hospital. It was a 4-story structure, and this is the current structure, but it was a 4-story structure. It had only about 100 beds or so at the time. And as Troy mentioned, this really started as a outpouring from the community, as there was a tragic situation where 2 children of the Drummond family, Deborah and Randall, they had gotten poisoned, and they had to take their kids. There was not a hospital in the community here, so they had to take their kids up the road and go to a hospital further north. And unfortunately, 2 of the kids passed away there. And that was a rallying point for the community. They got together and said, you know what, this is unacceptable. We need a hospital in our own community. And that's how the Debbie Rand Memorial Service League started. And through bake sales, any kind of fundraising efforts that they could do back then, that's what started the hospital. So in 1967, the structure that you see in front of you was opened up, and it was dubbed the Miracle on Meadows Road, which is, again, the support from the community was incredible, which continues to this day, I want to add. And within 10 years from this picture, from the opening, they were able to go an additional 5 floors on this structure to what the current structure you see now. So again, I just thought it would be good to see some of the old pictures, the history of the hospital. So again, just mentioned some of this already. It started out in 1967. So currently we have 400 beds. So we've grown additional through the years, over 2,800 employees, over more than 800 doctors and specialty physicians on staff. Boca Regional gets recognized quite a bit for their excellence of care, and particularly in the areas of cardiovascular oncology with our Lynn Women's Institute, our Lynn Cancer Institute, orthopedic centers, our emergency medicine, and the Marcus Neuroscience Institute. So a lot of these programs have been put into place over the last 10 years, and that's when it transitioned from a community hospital to more of a regional hospital, just based on all the centers of excellence that we've created here throughout the years. This year, we were once again recognized by the U.S. News and World Report as the top ranked hospital in Palm Beach County, so very proud of that. And within even Baptist Health, 6 out of the 12 top ranked hospitals in the Miami-Fort Lauderdale market, they call it, but includes Palm Beach and Monroe County, total of 74 hospitals. So Baptist Health had 6 out of the 12 hospitals in that best hospital category. So again, very proud of that. And then just again, some of our centers of excellence that I just mentioned. And then a little bit about Baptist Health South Florida. So as Troy mentioned, in July 1st of 2019, that's when Boca Regional joined Baptist Health. That's the first day that I started here. I was excited, been with Baptist Health 25 years, but I was excited to help with the transition of a new hospital into the system. So I was on the other side of the table at one point where the hospital that I was at transitioned into Baptist Health. So I thought this would be a good opportunity, and I was very excited to be part of Boca Regional, excellent reputation for many, many years. And it was really exciting to be part of that. So Baptist Health has about 23,000 employees. I mentioned the number of hospitals. Over 4,000 physicians. One of the areas that we've grown on is the ambulatory side. So over 100 outpatient centers, urgent care centers, and physician practices, and really going out to the community, just making that access, healthcare access, a lot easier for the patients by putting these outpatient ambulatory type settings out there in the community. As you know, Baptist Health is a not-for-profit, so we still maintain the not-for-profit status as when Boca Community Hospital started back in 1967. And we routinely get recognized by Fortune as one of the 100 best companies to work for in America. So been many, many years on that list. So kicking it over now to the Keeping the Promise campaign. So a few years ago, again, this hospital was built in '67, some additions in '70s and the '80s. It's a hospital that is aging. It needs some additional work. If you've been here, you know that some of our rooms are semi-private rooms, which in this setting is not the most ideal setting. But that's how the hospital was able to increase in size. So they have a lot of semi-private rooms. So right off the bat, our goal was let's increase the size of the hospital, but we're going to make this 100% private rooms. So this was going to require the addition of a new patient tower. So this is what you're going to be looking at. So part of this master facility plan that was developed was going to provide 100% private rooms. 20 brand new operating rooms. We knew we had to change the operating rooms out. We wanted to expand in our centers of excellence. And more importantly, we wanted to upgrade all of our intensive care units. So you see the list, the medical ICU, surgical ICU, cardiovascular ICU, and the neuroscience ICU. All of these areas needed to be upgraded and expanded. So with that, some of the major projects, obviously besides the tower, we needed to get a new central energy plan. So we needed something that was more efficient, something that was going to be able to provide power to not just the old structure, but to the entire medical campus, which we're going to look at here in a second. So that was first and foremost, that was one of the key projects that we needed to start with. And then we're also going to be building a brand new medical office building, the Toby and Leon Cooperman, again, an incredible philanthropic gift that they provided for us to be able to carry this to the next level. That's going to have 4 additional operating rooms, 4 procedure rooms, and much needed medical office space on our campus. So again, very, very much needed. As you know, we opened up the Schmidt family parking garage it was in February of this year, but it seems a long time ago because of the COVID situation. But we opened that up, and again, that was very much needed. It provided 972 additional spaces, and we wanted to add a new parking garage across the street that's going to be adjacent to our new medical office building. So with that, here's our first, this was really the first step. As I mentioned, February 2020, we opened up this brand new garage thanks to the Schmidt Family Foundation and their support. This is a timeline. So before we get to the pictures, just to kind of keep it in perspective, everything you see in blue is in the planning. So as you see calendar year 20, there's a lot of blue because there's a lot of planning going on right now. The other day I was asked at one of these similar town hall calls, well, how are you all planning all this and still providing the care in the hospital? Well, the answer is we're having to do this. We have to hit the certain timeline targets, and we're just finding additional time to do this, even during the COVID crisis, even during just normal routine hospital operations. So again, it takes a village to do this. Excuse me. And we do have a great team here in place that is working very, very hard. Sometimes we have 4 to 5 meetings a week based on with the architects, just looking at these different blue areas. So again, a lot of planning going on, but again, an excellent leadership team here at the hospital, and we're going to make this thing happen. So if here's a nice 3D shot. So we're going to be looking at number one is that's where the central energy plant there is going to be located. So on the back side of the campus, that's on the west side. The west side of the campus. And then number 2 would be our medical office building structure. Number 3 is the new parking garage that's going to be adjacent to it. And then number 4 is going to be the new structure. So that entire structure you see is brand new. And just to the top left of that, where you see existing garage, that's the Schmidt family parking garage that just opened up in 2020. So that could have been another shade of blue, because that was also part of the needs of the master facility plan. And then to put it in perspective, you can see where the existing Drummond Tower is located. So here's a nice overview. So again, you can see where the different areas are. So we're going to be looking at that, but this just gives you a nice overview shot of what the plans are. So the first phase is obviously the central energy building, which I mentioned. So again, very, very modern structure. The beautiful thing about this is the way it was designed and constructed. Any of the noise coming out of a generator, if and when they do kick in, will be coming out to the north. So being very careful, we want to be good neighbors to the neighbors to the south across the canal. So the way these are, they're a lot more efficient now too, and a lot quieter. If you own a generator at home, you understand that it's not like the old days. So it was designed in such a way to really push the noise out to the north, where the next thing that you're going to hit is the part of the hospital. So again, to the south, and I'm going to show you a picture of the south here. This is what the neighbors to the south will be looking at. A very modern structure, just looks like a regular office building. All these construction you're looking at are LEED certified, and you're going to have lush landscaping around the entire building. So we don't want it to look like a central energy plant at all. So it's really going to be upgraded quite nicely. Now we're going to be looking at the future, the parking garage medical office building. So here's the phase 2 is the Toby and Leon Cooperman Pavilion. And again, it's going to be providing ambulatory surgical suites, outpatient care, imaging capabilities as well, and procedures like endoscopy procedures. But again, very, very modern structure that is currently, if you go out the front entrance of the current hospital, this is the building you see to the right. That building that's currently there, it's a brick building called the 745 building. That building is slated to be demolished sometime in late January or early February in order to build this structure here. And let me see, that should have been another picture, but adjacent to it, there'll be a new parking garage as well. So that's where you see that parking garage structure in this overhead. That structure, right, there's no structure there now. It's a flat surface parking area, and that really provides additional parking for our emergency room, which is located right across the street. So again, this will be a 4-story parking garage that will support not only the medical office building, but also for the folks coming into the emergency room. So this is the patient tower. Again, beautiful structure. This is all entirely brand new structure. You can see Gloria Drummond patient tower. Again, one of Gloria Drummond's dear friends donated the money, quite a huge support to be able to put her name on there just to honor her good friend. So again, the philanthropic support here in this community has been just incredible. So when this new tower is built, again, I mentioned that we're going to have in the hospital 435 private rooms. We're going to be able to expand our intensive care units. If you see on the right side, just above those tree lines that are I guess they're more purple in nature. That is where the intensive care units will be located. So the medical surgical floors will be under where it says Gloria Drummond, and the structure to the right that would be coming out towards Meadows Road, that'll be all of our critical care units. So again, as I mentioned, all LEED certified, so we're excited about that. This is the view if you're coming from Meadows Road, coming east to west. Again, beautiful structure. You can see where the existing structure is on the right side of this photo, just to kind of keep it in put it in perspective where we're at. The medical office building would be to your immediate right. Just if you look at the right where this individual is walking on the sidewalk, that's where the new medical arts building would be located. Again, another view of the hospitals you're coming in. Obviously, the drop-off road is on the left side of where the palm tree line is. Again, beautiful structure. The front entrance is going to be beautiful roundabout area where we can drop off the patients and keep them away from all the elements. On the left side of the structure, this is where the Marcus Neuroscience Institute will be located behind this area as well. They'll be accessing this through the main entrance, but you'll see the photos, they're just beautiful. And this is if you're at the parking garage now looking towards the west, and again, those units directly in front of you, those are our critical care unit floors. So if you can imagine those glass area to the right, that's where the waiting rooms will be for this, for the critical care units. It's going to be absolutely beautiful. So when you come into the brand new lobby, this is going to be a 2-story atrium. If you see the overhead, you're going to see where the that's going to be where the surgical waiting area is, and all this is brand new building. This is where the current parking area is. We're going to have to do some obviously the construction to tie this in nicely with the existing structure. But at the end of the day, this is going to be a beautiful, beautiful building. This is the entrance. As you go to your right, again, heading west, you're going to pass a gift shop. You're going to pass a specialty pharmacy. If you go all the way down the corridor, that'll be where our new bistro is located. For those of you that's come to the hospital and had lunch, you might be doing it right by the lobby area in the bistro. So this will be headed down towards the bistro, and this is a photo of the bistro. So again, to put this in perspective, the floors above this would be where the critical care units are, and to the left, you'd be looking at Meadows Roads. So that's where that's at. So this will be a nice place for visitors, our staff, just to be able to sit down and have a relaxing lunch or just some quiet time in a very, very nice and modern setting. If you go back into the main corridor of the hospital, so going towards the left, this is where you're headed towards the parking garage. But again, if you look at the seating area, we didn't even know about social distancing when this was done, but you can see where we can accommodate that and still provide a nice setting for family members to get together. And the front outside the glass area would be where the main entrance, the drop off, and the driveway continues. So again, a lot of seating that are located like this, very conducive just to relaxing and providing a warm and friendly environment. And this is a courtyard. So to put this one in perspective, the parking garage is now to your right, and there's going to be a corridor that connects the parking garage in through the second floor into the portion of the building that I had just mentioned was going to be the new surgical areas, the new surgical waiting room. So again, we think this is going to be a nice area to bring patients in, and more importantly, discharge them right into the parking garage right after their outpatient surgery. And then most of this building, we anticipate this building to go up in the next 4 or 5 years. But then after that, that's when this final phase of the project, which is an important one, we're going to have to take this current building, which is again, needs some renovations in many areas. And we're going to be converting the semi-private rooms into private rooms, but we're going to really give it a facelift. So our goal is to make sure that when you're in the older structure, it still looks the same as what the new structure is going to look like. So again, there's some opportunities here as well. And through the renovations, I think it's going to be absolutely beautiful. Since we won't have semi-private rooms, the rooms will be bigger than what the normal hospital bed room would look like. So again, very excited about that. And one of the things I wanted to mention, because everyone's talking about COVID and antibody testing, our Baptist Health urgent care facilities do have a COVID antibody test available. And it's a rapid test. So if anyone's interested in attest this. If you go onto the Baptist Health Urgent Care Center, go into the Baptist Health site, you can actually make an appointment for that. I think they even have some walk-in capabilities as well, but they're providing an antigen test for the COVID virus. The last I heard, they were doing throughout all of Baptist Health. So there's a lot of urgent care centers. They were doing close to 1,000 patients a day at the community. So a lot of folks are coming in there. And just a reminder too, well, you get the results in 15 minutes, but you make your appointment, you can walk in or save your spot online. So if you go to baptisthealth.net/COVID test, you can access that, and everyone wants peace of mind with the COVID virus. And then the final thing here is at the same Baptist Health Urgent Care Centers, we're providing free flu shots, so you can get your free flu shot this season. And I confirmed you do get a green Band-Aid with a pineapple on it, so that's exciting. But again, if you wanted to get that done, I believe you can do it through the same website. You could probably walk in and do the same thing. But again, just another service that Baptist Health is providing to the community, just to keep everybody safe. We want everybody to be safe. We don't want anyone getting the flu, especially this year. It's going to be when the flu season does hit. It's a little scary for folks if you have flu-like symptoms in the middle of a pandemic, when one of the signs is having a flu-like symptom. So again, I would encourage everyone to get the flu shot, and again, reach out to Baptist Health. They're doing that free of charge. And I believe my last slide is, I love this slide. This is you have the superheroes paying their respect to the real heroes. And again, just all the healthcare workers here, they've done a tremendous job. The hospital staff, medical staff, and in the peak when everyone was staying home, these folks were coming into harm's way each and every day. So I just want to give a shout out to the staff here, and really throughout the whole healthcare industry. This is what you're seeing happening at Boca Regional is happening throughout Baptist Health, throughout all the other healthcare organizations. So again, we're managing through this. We're in good shape, and just want you to know the hospital is very, very safe. If there's any questions and concerns about coming into the emergency room is very safe. The hospital is a very safe environment to come in. As you can expect, we're doing a lot of things here to make sure that we keep everyone safe, including our staff, medical staff, and any visitors that come in through the hospital. So with that, Troy, I believe that's the end of my presentation. And I'll open it up if there's any questions.
Yes, Lincoln, thank you very much for that. Thank you for your leadership. Thank you for all that you're doing. We are extremely excited and fortunate to have you in now Boca Raton, leading our regional hospital, and now leading this amazing next step on the journey of what is our beloved community hospital back starting in 1967. That was just a lot of great information on the COVID side, on the expansion plans. Just a couple questions, maybe I can get it started. And so if anyone watching, if you have a question for Lincoln, just go to the Q&A button on your screen here and type in the question, and we'll try to get to it. We have a decent amount of time left to do it. Let me start where you started, Lincoln, which was on the COVID side, and amazing statistics. Thank you for those specific slides, because I think that gives us the perspective of the age groups, hospitalizations, the unfortunate deaths that we have, but gives people a perspective and a snapshot to understand that. I think that when we all wake up and we consume news in whatever way we consume it, it can be overwhelming for us, and maybe sort of knock us off our path a little bit. But that was, I think, very helpful to give us that perspective. So thank you. So when we look at the times when we're able to kind of flatten it, and then we had our spikes, and right now we're sort of in a flat time. And again, we know way more about this virus, how to treat it so much better. We're way further down the road. And so we would anticipate those numbers to continue to be solid, as you point out. But any, in your community, in the industry, any concerns about an anticipated spike simply because of holidays, family gatherings, like a July 4th, like a Labor Day that you're anticipating? And if you are, Do you think the spike will be less because, again, you're so far down the line in treatment and understanding the disease?
Great question. You covered a lot of things in there, but yeah, I will tell you that what we're seeing scientific, their projections, and again, people way smarter than I am, what they're projecting is that there is going to be another wave coming through. What no one knows is what kind of wave that's going to be. And again, I felt that the second wave was really a reflection on people just dropping their guard a little bit. I thought that it was. You know, I think here as a city, we did a lot of things, closing down the bars right off the bat, closing down any of the beaches, closing down. And I remember, you know, Mayor Singer would be calling me and asking me my thoughts because, you know, you can call myself, you can call George over at West Boca. I mean, you know, you want to know at the hospitals, that's where it's actually happening.
Right.
So, you know, for one, I don't watch the news just because I don't need the news. I can come into work every morning. But I will tell you, I think as a community, as long as we wear a mask, wash your hands, social distancing, you're going to minimize any kind of potential spread of this disease. So we are anticipating something, but I think we prepare for the worst and pray for the best, and just let you know that we are prepared. And I think based on the discussions that I'm on with the county still, and on the state level and on the system level, I think all the other hospitals are very, very well prepared for this. So, and you're right, the treatment is gotten a lot better. So once the patient comes into the hospital, they know what to do. Things that were being treated before, the infamous hydroxychloroquine was another one that in some cases it showed a positive outcome, but overall it wasn't really moving the needle too much. And it depends on when that patient was coming in. So in the first wave, you had a lot of patients coming in that were being placed on ventilators. That's kind of at the end of the cycle. By the time they hit that, there's other issues going on. So you want to be able to prevent this, and you prevent it by, again, the top three, just wearing a mask, washing your hands, social distancing. But if you do get sick, and there's people that are going to get sick, but if you do, then there's other ways to treat it now that we didn't know before. So what we're seeing now is we still see folks coming into the emergency room. Not everybody that's positive gets admitted. We just give them instructions that this is what you need to do. You don't meet any kind of admission criteria, but you gotta self-quarantine. You can't be spreading this disease to other people and your loved ones, and people are going to get it. You know, we've had patients in labor and delivery that have gotten it, and they make it through okay. So this is just the cards we're dealt with right now. And again, we managed through it, but I think we're in good shape right now. What we're seeing is the patients that are coming in, they don't seem to be as severe as they were during the first wave. So yeah, so there's a lot of information there. I know that, but
yeah, but I think it's good. You presented it in such a way that I think it's easier to consume and understand. So we appreciate that. Let's talk about a vaccine, if you wouldn't mind sharing your opinion on. I think there's a ton of really smart people working on this, and scientists, and there will probably be a number of vaccine options at some point. When, of course, is a big question. The trial process, sort of, you know, medically, if there is a vaccine available to the general public in Q1 of 2021, how long sort of medically does that have an impact to specifically combat the virus? It's not like as if the first one comes out, we all get to take it and we're good and the thing's over. You know, that there's a timeline there. What's your opinion on if we get, you know, legitimate, good, appropriate, FDA tested through the trial process, vaccine or vaccines, plural, that we could, you know, maybe take sort of a different approach about it, that it would be handled?
Yeah, well, as far as the vaccines, I do believe that there's something that's coming out soon. My brother, for one, told me he signed up for this thing, I think it was Moderna trial or something. Moderna. So he actually signed up for one of those trials, and I was shocked that he wouldn't call me and say, hey, this is what I'm doing. But he did it. I was like, oh, okay. So And I love him to death. So anyway, he signed up for the trial. So already a lot of these manufacturers that seem to be further ahead in the game, they're already signing up folks for this trial study.
Yeah.
So yeah, once that starts, I think if the results are even remotely positive right off the bat, which again in the experimental phase, apparently there's some good signs out there. But I think once that happens, I'm hoping that this vaccine comes out quickly and it's just given to everybody in this country,
Right.
as fast as possible. Now, we have gotten word from the government just to start preparing for how we're going to be providing vaccines to the different folks. So in other words, we have urgent care centers, we have, medical practices. So they're just kind of having everybody think about how we're going to be doing that as a healthcare system. And again, that's going on throughout the whole country. So, the plans are out there. They're planning to be able to provide vaccines to 280 million, however many we are now. But once that happens, we still have to be careful with. And we're a country where we have a lot of folks coming in and out of this country, coming on a routine basis. So there's a lot of things to consider with this. But yeah, I think we will be in good shape when we get a vaccine. And I remember seeing those pictures. If you ever watch any Korean or Japanese TV spot, you used to see some people with a mask. You go, I wonder why they wear a mask all the time. I'm not so sure that we're going to be in the same boat. I think you're going to see a lot more people wearing masks on a routine basis because it works. It stops the spread of not only this but routine viruses as well. It probably works for that.
Right. Yeah, I think it's clear, and along with you and the Boca Chamber, we are consistently sending the message that we still need to wear our masks. We need to keep our hands clean. We've got to keep our physical distance and continue to do that because it works.
It works.
It simply works. And it's good to hear, Lincoln, you've got enough PPE. Again, there's no shortage. We don't have to worry about our hospital being, out of that critical equipment that we need for treatment. Hopping over to this exciting expansion plan here, I wanted to point out, because I think it's important, again, in this sort of this next phase and journey of the hospital's history. You mentioned that the buildings are going to be LEED certified, right? Mm-hmm. I think that's critically important. I think in this day and age, when you have new development of the significance that is this. So I wanted to just reiterate that for our audience to say that, that this is Baptist and Boca Raton Regional creating not just a great patient tower in your background, but these are LEED certified patient towers. We're being, very accommodating to environmental issues on a go-forward basis. So congratulations on that.
Thank you. And Troy, I was going to say that over 10 years ago when Homestead Hospital was built, that was one of the first LEED certified. West Kendall Baptist Hospital was built. So when we're building new structures, we are 100% making them LEED certified. So
yeah, perfect. And in addition to that, I should point out that I know the landscape of the entry here, as you pointed out, is going to change a little bit. But from the renderings I've seen, and I know those will all come to life, and you mentioned it, it looks like the landscaping is going to be lush and Boca and very appealing, as we enter into this gorgeous campus. In addition, accommodating some of the neighboring neighborhoods, around that are fortunate to be right next to you, but would very much appreciate some of the additional greenery and landscaping that you're creating. So congratulations on that issue as well.
Yeah, we actually had a town hall meeting with some of our neighbors this past week, and we shared these pictures with them as well. They're our neighbors, so the theme was we want to be good neighbors, and we know we're here. I think I think some of the folks like living around a hospital because we're on a primary grid with FP&L. So whenever a hospital power goes out, we're on a priority list, obviously, as you can expect, just like the fire stations, police departments, et cetera. So that's one of the nice benefits about living next to a hospital. You get your power on a lot quicker.
Right, exactly. So Lincoln, the Boca Chamber's been around since 1952. So we were around when the hospital came, and we've been supporters since 1967. What can we do? What can we tell the people listening today from the chamber, from the business community, to help you with this? This is amazing. You know, we're just, this is to watch this happen, and the next evolution of the story and of the hospital itself is just incredible. What can we do as a business community, as a chamber, to help you with this project, to get it going, is so we can get out of the blue and get into the other colors where, you know, we got stuff coming out of the ground, and get, I think we're all eager and excited,
Yeah.
you know, to see it and to be a part of it. You can share anything you want with our listeners today about what can we do to help.
Well, I think first and foremost, it's going to be, this is going to have a tremendous economic impact in our community with the construction going on. So there'll be, you know, obviously more jobs, et cetera. We haven't gotten a finite number yet as to what that's going to do, but it will just, you can't, this structure, by the way, is going to be around $650 million when it's all said and done. Everything that I've been showing you this morning, that's the impact it's going to have, and that's going to be the cost. So we just want your support. We just want your support. This is a community hospital. We've been a faith-based not-for-profit entity for many years, and we're going to continue to be that. And we do a lot of good things in the community, and we do get a tremendous amount of support. And I could go on and on about the support that we have received from the community during this COVID crisis. It's been incredible. From the drive-by little parades that have been done, folks providing food, gift cards, and one day I jokingly said that I think the employees are putting on weight from the food that's been coming in on a continual basis. So it's been tremendous. So I have nothing but positive things to say about the support we have received from the community, and I just want it to be ongoing. It doesn't have to be food or anything else, but we're here for the community, and however they can support. Even right now, I will tell you, I'm looking at the flu shot still. Encourage your staff. Go get the flu shot. You gotta make sure that everybody is safe right now. Yeah. And even just getting the flu shot, you can get a free one now at one of the urgent care facilities. But yeah, encourage your staff to get flu shots. You know, we pretty much have all the healthcare workers getting flu shots, and we do that. We want people not to get sick, and especially this year, it's the great unknown. We don't know what a combination of a flu and a COVID virus that's out there is going to happen. So anything we can do to mitigate some of those exposures would be tremendous. But right. Again, that's what we can do.
Good tip. Get your flu shot. Yeah, and the amount of donors and who have been so generous. I probably maybe one of the envies of around the country, quite frankly, of the generosity of some people in this community to build this campus. Lincoln, I may have missed it. You may have missed it, but you've got the One Blood program. There's a question about the One Blood program you have. Maybe you could talk a little bit about that.
Well, One Blood, it's not just our program. One Blood is the blood supplier for the entire community. So I had mentioned before, one of the treatments is called the convalescent plasma treatment. That requires a plasmapheresis. It requires you to donate blood. So just like if you would go to One Blood to donate blood, they would do the same process, except they're going to be extracting the plasma that theoretically has that plasma in it. So One Blood, we've been working very closely with them, especially in the early days. Remember, this is all new, so there was not a mechanism in place for One Blood to identify potential donors because they had to be a documented positive patient. So we had the list of positive patients, but we just can't give that list to One Blood. So we have to reach out to the patients and say, hey, you might have some plasma inside of you that's going to save some lives. So we had to establish some kind of a protocol, because One Blood doesn't want a positive patient coming into the facility donating blood that would wreak havoc within their own system. So we had to make sure that those patients were tested negative. So if you ever passed by Boca Regional and saw like a tent outside the emergency room, we never used that tent to take care of patients. What we did was we used that tent to screen potential patients to donate plasma. So we were identifying the patients, former patients that could donate plasma, and then we were giving that information to One Blood and coordinating that. Because if you wanted to give it to a patient in the hospital, you had to have a number from One Blood corresponding to a donor. So it was very much donor directed, and then it had to be ABO-RH compatible as well. So it was a process, but we learned through it, and then throughout the system we were doing that. And there's been thousands of people that have donated plasma, but thousands of patients have received that much needed plasma during that time. But One Blood has done a great job in coordinating that, and they're here in several other communities in Florida as well.
Great. Well, thank you for that. You know, I knew this time would fly by. I mean, we've been on the phone for an hour already, which has been great. Again, I just want to thank you, Lincoln. You and your team are just doing amazing work in our community. Michelle McGovern's doing great work, and we're glad to interact with so many of your team, and Brian Alshel and so many others. Mindy, I could go on and on.
Yeah.
It's just a pleasure to have you. And again, thank you for your leadership on our board of directors. Very much appreciate that. I'm just going to mention one event coming up, and that's on December 2nd. We have our annual holiday auction, but it's going to be virtual. So Lincoln, you don't go to that auction and buy all those things. You can do it online now from your home. But on December 2nd, look for some information from the chamber about our virtual holiday auction. Participate if you'd like to donate something as well to that. We will graciously accept any items so that we can share it with our community. But with that, I want to thank everybody for joining today, spending time. Lincoln, again, let us know how we can help you along the way. This is just an incredibly exciting project, an exciting time for our community, you know, amidst the COVID thing. So this is great news. We want to help you as much as we can. So thank you to you and your team. Lincoln, we'll see you soon. To everybody else, thanks for joining. Stay safe out there. Continue to wear your mask. Keep those hands clean. Keep your distance. And we'll beat this thing sooner or later. So have a great day, everybody, and we'll see you on the next Zoom. Take care.
Thanks, Troy.